We have someone here tonight that is going to speak about healthcare. Hopefully we can learn one or two things that we can actually take home and implement or somehow affect some people at home. So I'm going to call on Angela Dyer to come and talk to us tonight on healthcare. Angela Dyer. Please support her by clapping and giving her a lot of applause. Thank you.
Hello, good evening, everyone. A good night, I should say. I'm Angela Dyer. I'm a registered nurse working at Woodhall Hospital, along with Dr. Anyoko and quite a few of the team members here. There at Woodhall, in our practice, we provide care for the HIV positive patients, as well as the affected clients. We work there as an multi-interdisciplinary team using a holistic approach in caring for our clients. We provide care for the community at large. Our population stems from the newborn to the older adult. Our youngest being 20 days old, oldest 79 years old. So, reading today from the CDC, Center for Disease Control, it says that African Americans have the most severe burden when it comes to HIV among all the racial ethnic groups in the United States. And comparing to other races and ethnicities, they account for the highest proportion of HIV infections. And some of the numbers are really alarming. The African Americans account for an estimated 44% of all the new HIV infected amongst adults and all adults and adolescent blacks. The estimated rate new HIV infection for black men was 7 times higher than that of the white men. And know that for women, it's like 20 times higher than that of the white woman. The black woman is 20 times higher of that of the white woman. Now we have the gays, the bisexual, and the men having sex with men, which account for, estimated for 72% of that. In 2010, an estimated 17,000 blacks were diagnosed with AIDS. Not HIV, AIDS. This number that has remained relatively stable since 2007. By the end of 2010, an estimated 250,000 blacks were diagnosed with AIDS and died. Over 250,000. Before it was the bulk of the patients coming in positive were that of middle age. But now we're seeing a shift in the age group. We have lots of teenagers now. We have the geriatric population. As a result of that, at Woodhall Hospital, we have set up shop even in the geriatrics clinic. The latest was a 78-year-old that was tested positive. We have the teenagers that are coming in from the middle and the high schools. we have counseling and testing, and they are coming in positive. There's a lot of barriers that we face there in terms of effecting care. We are faced with the stigma, the fear, the discrimination, the homophobia, and the negative perception of HIV. So HIV testing can also place the African American at a higher risk as a result of that. Some of the stories that will always stick in my head, stays in my head, is and who patients that I've had one-on-one with. I'll tell of the teenage boy, the 15-year-old, who came in HIV positive from school. And in talking to him, I just asked, so tell me, how many sex partners have you had in the past year? And he was quite calm. He was like, 1, 2, 3, 4, 5, 6, 7. And he had a partner with him, not counting his partner. So it's obvious that we have a problem, that we need a lot more education in our schools. Another story is a young man who, every time he comes to the clinic, he would tell of partners that he'd been sleeping with and not telling of his status. He was so angry that he says, well, no one told me, so I don't care, I'm not telling. The young lady who is dating and not telling. We have one female who is engaged to be married and living with her partner for years. Also has set a date for her wedding and still haven't told of her HIV positive status. The 24-year-old who now delivered her 5th baby with all different baby fathers, none of which knew of her status until later. At one point in time, we had to have some intervention because there was domestic violence there. When the partner found out, we had to literally move her from where she was living. We have also the divorced after 20, 30 years living together and back in the dating field. Ladies who sit and tell me, I don't know how to use a condom, but they turned up HIV positive after starting dating post their divorce. Again, a lot of work needs to be done in terms of education. So here at Woodhull Hospital, we care for our patients in a holistic manner. We try to address all the issues and the barriers that are in the way. Whether it's the adherence, we have substance abuse issues, we have the fear of the stigma, the fear of them going out and telling their stories or telling their families, telling their loved ones, telling their partners about their health issues. Our team comprises of medical providers, GYN, and I should talk of our GYN prenatal care program there at Woodhull Hospital. Dr. Cummings, who is in our audience. She has delivered a lot of babies that are born HIV negative from HIV positive mothers with the care that we provide there at Woodhull. We have pediatricians on board, ophthalmologists, the dentist, nutritionist, mental health, caseworker, our clinical pharmacist, Dr. Day is also in the midst, other medical providers, Dr. Anioko. So, we know we have made enormous stride in the treatment of HIV AIDS, where individuals can be tested, can be treated with 1 pill a day. But we have yet to come up with a cure. So finally, I'll say until we find that cure, we need to educate our children, our families, our friends, our community at large, medical providers, your patients, but most importantly, ourselves. And with that, I say, thanks for hearing.
Thank you so much, Dr. Dyer. Thank you. Please, one more round of applause for Dr. Dyer, please. I hope you are all listening to her, because clearly the issues she raised here tonight were mostly people that are fairly young. So if this is happening in this society where there is a lot of education about AIDS and medical issues, you can only imagine what magnitude we're dealing with in Nigeria. So I hope you got a few things from her. I hope you get that transcript of what she said tonight, because I would like to read it actually in detail and sort of get every point that she raised tonight. You should have been fed by now, or you should be getting fed as I speak. We don't have much on our agenda for the rest of the night, so we're actually going to open the floor. I hope now that you've been fed, you have some more energy. We want to fill up this floor tonight and actually have a lot of fun. In a few minutes, or in a little while, I'm going to be calling on the Urban Youth group to come out and entertain us. But in the meantime, we're going to open up the floor. Please feel free, the floor is open to everybody. As you eat, or if you finish eating,